Sige, ready na? Everyone settled na? Dili na dyan mo masayaw? Sige. Okay, so we're gonna be discussing about peripheral vascular system. So the vascular system consists of your arteries, veins, capillaries, and your lymphatic system. So the arteries carry oxygenated blood. So namely, here you have, ay, wait lang ha. So you have your brachial artery. So it is usually located medial to the biceps tendon, followed by your radial. So radial is lateral. So in line siya sa thumb. So that's why it's located lateral to the flexor surface. The medial one is the ulnar artery and your sa kamay. So arterial branches are the arches here. So for the arteries in the abdomen, so it is divided into um, three. So you have for foregut, you have your celiac artery. So all came from the branch of your aorta, which is the thoracic aorta. So the first is your celiac artery, distributes to the foregut. So the foregut has ito. So the foregut includes the esophagus, stomach, liver, and pancreas. So the next is your SMA or the superior mesenteric artery distributes to the midgut. So the midgut, jejunum, so the small intestines, the ileum, the cecum, the large intestine. So the IMA for the hindgut. So this one, descending colon, tapos sigmoid and your last is your hindgut pala. So apat. So the arteries, so the lower extremity also has your artery. So you have your femoral. So femoral artery is just below your inguinal ligament. It is midway between your ACs and your symphysis pubis, followed by your popliteal. So it is usually palpable behind the knee. Dorsalis pedis. So this one. Dorsalis pedis located on the dorsum of the foot, lateral to the extensor tendon of big toe. So dito. So ito yung dorsalis pedis and your posterior tibial is sa posterior just behind the medial malleolus dito sa likod. Okay? So, from femoral, popliteal, dorsalis pedis, and sa medial part is your posterior tibial artery. So now we go on to veins. So veins are thin-walled, they are highly distensible, contains valves to provide unidirectional flow. So veins from the arms, upper trunk, head, and neck drains to your superior vena cava, and sa abdominal area drains to the IVC. So, di ba lumabas to sa exam? So, true or false ata to. Okay. So the veins are divided into two. So you have your superficial and your deep veins. So the superficial veins are usually subcutaneous. So superficial lang jud siya with poor tissue support. However, for the deep veins, it carry 90% of the venous return and is well supported. So for the lymph nodes, so lymph nodes are round, oval, bean-shaped structures that vary in size and their location. So the lymph nodes in general play an important role in the body's immune system. So on your physical examination, you can usually palpate the superficial ones. So you have here the epitrochlear, the axillary, and even the cervical area and on your leg. So here on the inguinal area. So the lymph nodes can be small. So remember, sa preauricular, you have a small node there, and they can be even large. So a good example is your inguinal node. So it can be about 1 to 2 cm. So the epitrochlear. So ito yon, yung epitrochlear nerves. So drains the ulnar surface of the forearm, hands, little and ring finger, and the adjacent part of your middle finger. So usually located on the medial surface of the arm, 3 centimeters above the elbow. So this one. So that is your epitrochlear. The axillary nodes here, you have your lateral and your central type. So drains most of the arms. So for the lymph nodes on the lower extremities, it is further subdivided into a superficial and a deep, right? So sa superficial, meron pa siyang sub-classification we call the horizontal and the vertical. So this is the horizontal, lies in chain in the anterior thigh below the inguinal. So this is the inguinal ligament. So you can feel or you have your horizontal chain of nodes. So just here. So it drains the superficial portions of the lower abdomen, the buttocks, external genitalia, except for the testes, anal canal, perineal, and the lower vagina. So for the vertical, so as you go down here, you have now your vertical group of superficial lymph nodes. So these are clusters near the upper part of the saphenous. So this is your saphenous vein. Just beside it is your vertical group. So, and it also drains the corresponding region in the leg. So lesions in this space are not usually associated with palpable inguinal lymph node kasi you have your horizontal group naman sa taas. So why is it important to know the difference? So like the arteries, the veins, and the lymph nodes. So because the common concerns you get to see at the ER pertains to, like for example, when you check for the lower extremities, so they might come in with an abdominal pain or back pain. So you should also include for the extremity to check for the extremities for the good peripheral blood distribution of your arteries and kung maganda pa ba ang drainage from the veins and even if there are lymphadenopathy. So these are the common concerns you get to see at the ER. Patients might come in with abdominal pain, pain in the arms or legs, so intermittent claudication, and etc. So, one of the common cases is your peripheral arterial diseases. So, refers to stenotic occlusive aneurysmal disease. It can be from the abdominal aorta, the mesentery and its renal branches, and the arteries, and the arteries of the lower extremities, except for the coronary artery. So when you suspect of your PAD or your peripheral arterial disease, you ask about like for example, does the patient have abdominal, flank, or back pain? Are they previous smokers? Is there any history of like bowel changes, voiding problems? Because you need to rule out problems arterial. So if they have like expanding hematoma from your triple A, your or your um, abdominal aortic aneurysm. Okay, so food fear or changes in the stool or even weight loss rather. So you suspect for mesenteric ischemia. And this one, what do you call this one? Pain or cramping in the legs. Pain or cramping in the legs during exertion, relieved by rest within 10 minutes. What do you call this one? Starts with starts with I and C. So intermittent claudication. So this is also common for PAD problems, okay? So ask about coldness, numbness, pallor. So these are all pertaining to even loss of hairs anterior. So pertaining to PAD din yan siya. So take note, only 10% of those population present with a classic feature like leg pain, that is leg pain with exertion and relief by rest. 30 to 50 have atypical leg pain, and 60% of those are asymptomatic. So that's why a good history will always lead you to your diagnosis. Okay, so high risk patients, so these are considered high risk patients, those who are 50 years old and PAD risk factors such as smoking history, diabetic, hypertensive, dyslipidemic with an African American descent, and coronary artery disease history. So here are the peripheral artery disease warning signs. So patients might present with fatigue, aching, numbness, or pain that limits walking or even just limits walking or there is an exertion in the legs. So if present, identify the location and identify the location of the pain. Okay, so those are part of the warning signs. Poorly like non-healing wound, specifically on the legs or feet. Any pain present when at rest in the lower legs or foot, or changes if there is any numbness when the patient stands up or in a supine position, and if there is abdominal pain. So again, this pertains to your mesenteric ischemia, food fear, weight loss, and any first degree with triple A. So take note, two common types of atypical. So remember, atypical presentation is about 30 to 50%. So that's why you need to, these are atypical symptoms. So leg pain on exertion and even at rest. Kasi di ba kanina ang intermittent claudication is relieve siya with, so this one also, pain or cramping the legs during exertion, relieved by rest within 10 minutes. This is intermittent claudication. So the atypical one is leg pain at exertion and at rest. Okay? So this is an atypical presentation. So the other one is leg pain or carry on. So meaning there is exertional pain that doesn't stop the patient. So meaning makalakad pa din ang patient despite having the pain. So these are the atypical leg pain of PAD that might be a symptom already of your critical limb ischemia. So these are the, as part of the arterial problem, these are the important topics, okay? So we need to screen them for lower extremity peripheral artery disease. So check for the risk factors or even screening them for the history itself. Computation of the ABI or the ankle brachial index, screening for renal artery diseases, and the AAA or the abdominal aortic aneurysm. So these are the, aside from those mentioned earlier of being 50 years old, male, so these are the age group that you should be more cautious about for developing the lower extremity peripheral artery disease, age of more than 65, or 50 years old but with a history of smoking and diabetes, leg symptoms or pain upon exertion, and the non-healing wounds. So next, after you screen them for lower extremity pad, of course, we're gonna compute for the ankle brachial index. So this was lifted from your book. It is said that the patient should rest supine in a warm room for at least 10 minutes before the test. So of course, you need to prepare your BP apparatus as well as your what you call this vascular Doppler, so that you can hear the pulsations clearly. The important thing for upper extremity is, of course, you just need to locate for the brachial pulse. For the ankles, there's two. You can locate for the dorsalis pedis and your posterior tibial pulses. Okay? So there's two sa low sa ankle. Sa taas is just brachial, but there's two pulses sa lower extremities. Okay? So what we're actually same lang sila. Of course, you just need to locate first the pulse. You put your vascular Doppler there, and then you need to inflate cuff from the last audible. So you need, di ba kung sa normal, it is 30, but in here, you just add 20. So deflate slowly until the and record pressure at which pulse becomes audible. So a minimum of two records should be done. So same goes dito. So first you do the dorsalis pedis and repeat the procedure again for the posterior tibial arteries. So ito yung usual na readings nila. So again, lahat ng left sa isang corner, dito naman lahat ng right. So brachial, dorsalis, and posterior tibial. So, ganun siya. So, ankle brachial. So, from the word itself, ang nasa numerator, tama diba? Sa taas, is your ankle, the test or the average of the ankle pressures. And the lower, and yung denominator is your arm pressure or your subbrachial pressure ninyo. So, just the average among the two. Sige. Try, ito yung interpretation of your ABI. So 0.9, more than 0.9 is your normal. So the rest, memorize nyo na lang. So this one, sige. Try natin ito. Kaya pa? Kaya ninyo? Huh? Sige, sige daw. Get the average na lang of this one. Sige, para at least ma-apply ninyo na dili lang ako nagayaw-yaw diri sa front. Sige, anong average? Dapat you use the systolic pressure. Ano ang systolic dito? 130 or 90? Sharo. Sige, 130. So, 130 plus 140 divided by 2. Ha? Sige, pila. O yan. Yung isa, 90 plus 88 divide by 2. So, sample lang to ha. So, it's 89. So, pag ankle, brachial, so ano saan mauna? Si 89 over, so yan siya. So, 89 over 135. Na-get? 89, 135. So, ang score is 0.65. So, ang 0.65 is 0.65. Mid pad siya. Okay? Sige. Get my question? Wala na lang. Sige, continue. Sige. So, treatment of pad. So, pad and intermittent claudication, according to ACC FAHA guidelines, they suggest to do a supervised exercise program as the initial treatment. So meaning ipa-exercise ang patient. So ito yung mga for mga rehab natin. So other recommendations, of course, ask them to stop smoking, treatment of the underlying disease, antiplatelet, and for some revascularization of that area. So the second or the third one, so we're done with the screening of your lower extremity pad, ABI. Next would be screening for renal artery disease. Actually, you suspect renal artery disease no pag mga pagbata na hypertensive, you suspect that they might have renal artery disease. So onset of hypertension less than 30 years old or severe hypertension more than 55 or yung mga resistant type or mga malignant type. So despite taking in a lot of antihypertensives, mataas pa din ang kanilang BP. So yan siya. So new, another would be your new worsening of renal function. Like for example, after use of an ACE inhibitor or ARBs or unexplained small kidney. So more than 1.5 cm daw na discrepancy. Or sudden onset of pulmonary edema, and in the setting of worsening renal function. So, you also screen for RAD or renal artery disease. So the last among those screening would be your AAA or your abdominal aortic aneurysm. So abdominal aortic aneurysm is defined as infrarenal aortic diameter of more than 3. So they are prevalent among older adults, so more than 50 years old. More common siya in men than in women. So the chances of rupture if ang size niya mag-exceed ng 5.5. The strongest risk factor for AAA is, of course, older age, being a male, and a smoking, and strong familial history of AAA. So other risk factors include, ito, so taller height. Usually common kasi ito sila sa mga parang, basta meron siyang genetic defect na related with a taller height. Nakalimutan ko sa term. Basahin niyo. Basta yan, meron silang history of coronary artery disease, CVA, hypertension, and hyperlipidemia. So this one, the USPSTF suggests that grade B lang yung recommendation nila for a one-time ultrasound screening for men ages 65 to 75. So ilang sticks kaya na kailangan mag-screen na for ultrasound? Ha? Kagamay sa 20. Other. 100. So, kung nakasmoke daw sila more than 100 cigarettes in a lifetime, they warrant already, at this age, 65 to 75, you can do daw your ultrasound. So here are the key components also for your peripheral artery examination. Of course, aside from your ABI, you need to also do your blood pressure taking, di ba, in both arms. Malay mo, ano pala sila, meron silang renal artery disease or poorly controlled yung hypertension nila. So check also for the carotid upstroke, auscultate for bruit, mga bruit sa chan, or even sa femoral area, palpate the pulses, and inspect the ankles and feet for the color, temp, and the skin integrity. Check also for ulcerations. Okay, hair loss, mga hypertrophic tails. So we go now to our PE. So this is techniques of your examination. The important areas of examination. So again, arms, abdomen, and the leg. So for arms, check for size symmetry, the pulses, so radial and the brachial pulse, and your epitrochlear lymph nodes. For the abdomen, pulsations, and include also your inguinal. For the legs, ito, madami-dami. So the size, the symmetry, the color, even the temp should be included here. The pulses, yung apat, yung femoral, popliteal, dorsalis pedis, and PT. So the calves also to check for swelling, ulcerations, and mga lesions. So let's start off for the upper extremity or sa arms. So we check for this is the radial artery. So as a technique here, di ba radial is outside sa my thumb. So you can ask them to slightly flex the wrist to feel for the pulse. Okay? Check using your finger pads lang on the flexor surface of the lateral wrist. So this one is your brachial. So as a technique din dito, asa na tong nag BP sa ako anak. So saan ang brachial? Medial, lateral?
Medial po, Doc.
Somewhere daw. Ay, hala. Very good. Very good. Wait lang. Asa si CCTV? Sige. Okay. Very good. Very good. So, again, for the brachial, it is usually located medial. Okay? Medial, anong tendon? So, biceps tendon. So, ang technique dito, pag hindi mo siya ma-feel, you ask them to slightly flex. Okay? If not, kung dili pa jud, you ask them, you can move in between sa imuhang insertion sa imong muscle sa taas. So, you can move upper pa. But then, it is located medially. Okay? So, mao siya ang iyang location sa brachial. For this one, this is your epitrochlear. Ilang cm above the elbow? Huh? 3. Epitrochlear. So 3 cms above the medial epicondyle. Okay? So actually, in most healthy people, difficult din siya to palpate. So this one, what test that is used to check for patency radial and ulnar arteries? Allen's. How do you conduct? Sige daw. I-discuss na lang ako. Sige. So Allen's test. So So this test is used to check for the patency of your radio-ulnar artery. So this test also ensures the patency of your ulnar. So yung ang ulnar niya before blood extraction. Kasi 'di ba, you also do blood extraction sa may antecubital space. Of course, you need to check first if patent ba ang distal area. So actually gikuha nako ni for the picture itself. But do not mind na lang the label. It's a modified Allen's test nakalagay. But as a step-by-step process, ask the patient to position hand in the lap and with the palms up. And then ask the patient to make a tight fist. So with one hand. Tapos you compress now your ulnar. Saan ang ulnar dito? Ha? Oy, ba't hindi same ang answer niyo? Sa to kong gipahutana. Ang ulnar, saan ang ulnar? Lateral, medial. So, medial. So, ang in line with the thumb is your radial.
Yan.
Okay, so you compress them all at once. Ano ang una mong i-release? Ano nakalagay dyan? So, sorry, anong i-release? Ask the patient pa pala. So, naka-fist, then compress, then open, then release. Anong una i-release? Ulnar. Ha? So, ulnar ang i-release. So, anong expected? So, magbalik na yung red within 3 to 5 seconds. Okay? So, again ha, close, palms up, close, then compress, then open, release. So, pag mag-open na yung kamay niya, mapansin nyo that it's already white. So, mo to, pag release, you expect hyperemia. So, una ang i-release is your ulnar side. Okay, so expect that the redness goes back within 3 to 5 seconds. Okay, so again, you ask them to compress again, ulnar, then radial yung last. Okay, na-get? So
Yes
this
po, Doc.
one, thank you, thank you. So this is a this is a negative Allen's test. So yung negative is a normal kasi nag-red siya. So yung positive, it remained pallor despite na-release mo na yung pressure. Okay? Sige. Get. No question? Proceed. Okay. So, eto siya. Ay, mas klaro din ni, sorry. So, again, negative Allen, pag there is hyperemia when you release the ulnar side. So, this is a positive one. If it despite releasing the ulnar side, nagpallor pa din. Okay? So, next. So, this one. What condition is this one? Raynaud's. Okay? So, this is a Raynaud's. So, Raynaud's, when there is exposure to cold or extreme heat, the patient experiences what you call this pallor, then cyanosis, then hyperemia again. So these are one of those common conditions related to the arterial diseases. So now we're done with the upper extremity. So we'll proceed with the abdomen. So when doing the abdomen, same goes, ha? How do you do your abdominal PE? I am Pepa. So inspect, auscultate, percuss. Yes. So you just do it the same, but just give emphasis to the pulsation. So you have your abdominal or check for bruit and for the inguinal lymph nodes. Okay. So the bruit can be aortic, renal, and femoral bruit. So for the leg, so the lower extremity, so check for the size, symmetry, color, and the pulsation. So let's start first with this one. This is your femoral pulse. So femoral pulse is located, it is usually felt in a deep palpation located in between your, saan siya located? In between ACs and symphysis pubis. Okay, midway there. Kaya nandito. And just below the inguinal ligament. So, as a technique, lalo na pag medyo obese ang patient, use two hands. So, you can just, on the side, you can do deep palpation. This one. You can just use your finger pads to press or even push if it on the other. Okay? So, sa mga obese patients. So, this is your popliteal. So for this one, the popliteal is usually located behind the knee. Okay? So this one, you ask the patient to flex the knees and of course, relax. Hindi dapat nakatense ang lower extremity. So place fingertips of both hands so they just meet at the midline. So just located behind the knees. Okay? You press it deeply and if widened yung popliteal pulses, it suggests what? Pag widened. Aneurysm. So here's another technique. So ito popliteal pa din ha. So you can just ask the patient to position on a prone and then flex the patient's knee to about 90 degrees. Dapat ito. So you can support it dito sa may shoulder mo or sa upper arm. Okay? So press your two thumbs together. Midline din ang location at the popliteal fossa. Okay. So this one. So this is your dorsalis pedis. So ano basta big toe. Basta sa big toe, just locate your big toe and lateral to it is your when you ask the patient to flex and then sa lateral siya na aspect on the dorsum of the feet is you locate your dorsalis pedis. So if you cannot palpate it here, so you can always move laterally to feel for the pulse. Okay? So this one, this is your PT or your posterior tibia. Ang tip for your PT is always siya sa behind the medial malleolus. Okay, so this is ito dito. So, practicean nyo pagdating nyo sa bahay. Mamaya. So this one, what is the grading used in pulsations? 1, 2, 3, 4, 5, 6. Ilan? What is the normal pulse? Plus 2. So ano ang up to ilang grading?
Four.
4. Hindi. Ang answer is 3 lang siya. So 3 up to 3 plus lang. So 3 plus is already bounding. Kasi 'di ba parang letter B yung 3. So bounding. Pero ang 2 po di ay brisk. So basta ang normal is 2. So 2 plus is brisk or the normal. So 1 plus diminished then 0 absent. Unable to palpate. Makulbaan na kapag 0 ang imuhang grading sa pulse. Sige. May question mark dito. Ito. So what are you gonna do if difficult to palpate ang pulse? Then, ito. So you need to position your body properly. And of course, the examining hand as well, you need to have it in a proper position. Kay awkward positions decrease tactile sensitivity. So once your hand is positioned properly, linger and vary the pressure of your fingers to pick up a weak pulsation. If unsuccessful, explore the area gently but more deliberately. Basta mag-explore ka. Do not mistake the patient's pulse. Ito, common. Kaya 'di ba gina-encourage sa inyo to always use the finger, not your thumb. Kasi you get confused kung kaninang pulsations. That's why you use your finger pads. So pag once hindi mo siya ma-determine, count down your own heart rate and compare it to the patient. So usually the heart rates are different. So of course, ang pinakamadali and pinakamalakas is your carotid pulsations. So this one. So now we're done with the arterial, I think. Ah, ito, sorry, meron pa pala. So, the postural color changes of chronic arterial insufficiency. So, actually, this is new as compared to the previous one. So, you have at least 3 ata na bago. So, you have Berger's test. So, Berger's test is that you raise both legs to about 90 degrees for up to 2 minutes or until there is foot pallor. So, for light skin daw, expect to see a normal color on the raised leg. So, not as pallor. Pero for dark skin, as a technique, is you check for the sole of the patient. So, use tangential lighting. If putla na talaga, there is pallor on the soul of that dark-skinned individual, then ano na siya, na-drain na yung dugo on that side. So after you raise the leg of the patient to about 90 degrees, ask the patient to sit up. So dangling ito. So nakaganon lang yung legs niya sa bed and compare the both feet and take note of the time. Actually, i-time mo lang siya kung gaano siya katagal mag-feel. Okay? So the return of the pinkness to the skin is about 10 seconds. So, mag-pink yung color, 10 seconds. So, feeling of the veins, 'di ba? 'Di ba pag mag-raise kayo ng paa, mag-compress man ang veins. So, pag ma-feel na yun siya, it would take about 15 seconds. So, the color is faster at about 10, but feeling of the veins of the feet and ankle is about 15 seconds. Okay? So, burgers is nakadangle ang legs. Okay? So, remember this one. So, ito yun siya. So, this is the burgers test. Legs elevated. Tingnan nyo, medyo pale. So, ito yung ginasabi na feeling of the vein. So, it would take about 15 seconds. Okay? So, yan siya. So, it would just note of the time. So, this one. So, this one. So, this is for the thighs, calves. Check for swelling and edema. Okay. So, I have a question. Is it the same? Pareha lang sila ba? Yes, no. So it's not the same. Okay. So in pitting edema, here, it is usually soft and bilateral location. It is a palpable swelling due to increase of your interstitial fluid. So, for example, when you go on like long hours of standing, or for some, pitting edema can occur in heart failure patients or nephrotic or just plainly mababa lang yung albumin sa katawan. As for this one, this is a classic example of your lymph edema. It is still soft and peaking, but then becomes indurated. So it becomes hard and then becomes non-peaking because of skin thickening. So as you can see, so ito yung ano nila, thickened skin or hyperpigmentation. Sorry, no, I mean thickened skin lang siya but no hyperpigmentation and ulceration is rare. So this is also due to the accumulation of protein-rich fluid when the lymph channels are obstructed. So the lymph channels might be obstructed because of the tumor, inflammation, or even mga post-radio patients, post-radiotherapy treatment patients. So again, so lymphedema and pitting edema are two different conditions. Okay, so this is an example of your pitting edema. So when you assess a pitting edema, press firmly but gently with your thumb. So for at least ilang seconds. Dok, mga 30 seconds. So 2 seconds lang over the dorsum. So pwede dito or behind the malleolus. Kasi 'di ba medial malleolus because of the dependent area. And pwede din sa shin. Dito sa front, sa anterior leg. Okay? So dorsum, the medial malleolus, and the anterior shin. So those are the area you can palpate for your pitting edema. So these are the arterial disorders you can find in your book. So you just read through it, and this is the venous disorder. So common venous disorder, di ba, yung mga varicose veins. So ito mga CVI yan siya. Or DVT ata yung isa. This one. So next, this one. So this is an example of what you call this? I- um, unilateral swelling. So ito yung kanina. So unilateral swelling or edema. So make sure when you examine unilateral swelling, make sure to measure the calves 10 cm below. So this is your tuberosity, no? Tibial tuberosity. So dito. 10 cm below. And yung normal lang nila na half difference or the measurement should be about 3 cm lang. So any more than that is really something worrisome. Okay, so this one. So we're done with the arterial aspect of assessment. So we go to the peripheral venous. So this is the venous condition now. So a common one is your venous thromboembolism. So this is more common no sa mga patients with central venous catheter like mga IJ, naka-PICC line. So these are those access points that can cause your possible VTE. So ask if they have arm discomfort, pain, paresthesia, and weakness, and of course ask if they have pain on the lower extremity. So when you suspect of VTE or your DVT, what scoring is usually used? So you use your Wells scoring. So this one. So another one, the common, as I mentioned earlier, is your varicose veins. So Bates has also included the mapping of your varicose veins. So in here, what you're gonna do is that the purpose of doing the mapping is that it demonstrates the origin of the varicose vein. So what you're gonna do is that ask the patient to stand. So like ganito na position, place your palpating fingers gently on a vein and your other hand. So bali nakaganon. Okay, so and compress the vein sharply. So feel for actually dito feel for a pressure wave. So if you have felt ang pressure wave daw should be felt on the upper arm. So if you have felt a pressure wave, then most likely the one that you have occluded on this side is also connected. Bale, same lang yung origin nila. Okay? So this is the purpose of doing your mapping. So next, so another, this is the third na ano din na bago is your Trendelenburg test or your retrograde feeling test. So this is done to assess for the competency of your venous valves. So competency of the valves of communicating veins and the venous system. So for this one, kanina, 'di ba, ito nakatayo. Yung first, yung burgers is in supine tapos naka 90 degrees, 'di ba? Tapos you dangle the legs. The mapping is a standing. Ito is a supine position. Ganun pa din, same with burgers. I-elevate yung one leg to 90 degrees and to empty the venous blood. So occlude now ang great saphenous vein. Saan ba ang saphenous vein? Medial lateral. Saan siya? Ang great saphenous vein. Sa may thigh, 'di ba? And usually most likely located on the medial side. So, you compress that one sa upper thigh o manually compressed and you ask the patient to stand. So, naka 90 degrees, while naka-compress and then naka-stand. So, at the first is that dapat naka-occlude. So, when the patient is already standing, naka-occlude pa din yung paa, ay yung vein. Tapos, check for the venous filling. So, normally daw, ang sa venous vein fills about 35 seconds. So, next is that you ask the patient to stand again for the next 20 seconds and release na yung compression sa great saphenous vein. And look for sudden additional feeling. So, yan. So, normally, slow feeling continues because of the competent yung valves niya to block the retrograde flow. Okay? So, ito yung third na bago. This is now the Trendelenburg's test. So, for the venous disorder, so this one, ito. So actually common kasi ito, mga arterial and venous. So we need to differentiate one from the other. So this one, what do you think is this one? Arterial or venous ang cause? Bakit arterial? May gangrene. Ay, yung isa, ulceration. So chronic venous insufficiency. So yan siya. So this is classic picture of an arterial disease. So this is your CVI. Okay. So wait, sige, mag-dwell muna tayo dito. So this is a peripheral arterial disease. So remember, pag arterial, it brings oxygenated blood, 'di ba? So when there is a problem or there's poor blood supply, of course, that's why magiging gangrenous yung area kasi wala na siyang blood supply. So that's why in patients with arterial disease, there is presence of your tissue ischemia. So patients tend to have intermittent claudication. So, di ba at first, the pain will be relieved at rest within just 10 minutes, but then they develop to a pain even while they're at rest. So ito yung mga atypical pain symptoms. So for this one, of course, the blood supply is cut off. So the pulses are absent or present? Absent kasi wala mang blood supply. So poor yung blood supply to the area, you expect warm or cold? Cold kasi wala mang blood supply. So it's a cold to touch, atrophic yung skin, tapos meron ding loss of hair and thickened nails din ang patient. So pale on the on this side when you elevate it, it's also pale and dusky red din siya pag maging dependent. So ulceration daw usually is at the point of trauma and this one is an example of a gangrene. So always remember pag arterial, it's gangrenous. So this one for the CVI or the chronic venous insufficiency condition. This one is often painful. Tapos meron din silang mga venous stasis. For this one, normal, abnormal, normal or no pulse? No pulse na, Jude. So, it's normal ang pulse. But then, meron lang silang edema. So, there is presence of edema and the color is about dusky red. Tapos ano din, they become cyanotic when pag ano sila pag naka on a dependent position. Just take note, pag mga CVI conditions, they tend to have hyperpigmentation as you can see here. At times, may mga peticulae pa ito sila. So these are signs of CVI. Really common ito sa mga ESRD patients. So ganito talaga ang mga paa nila. Lalo na pag mga diabetic din. So, but then, pag mga CVI patients, their gangrene doesn't develop and usually normal yung kanilang temperature. So, here's another picture. Pag venous, usually located above the medial malleolus or the lateral malleolus. Pag arterial, di ba, sheen? Loss of hairs anterior sheen over the points of trauma, as mentioned earlier, pag arterial. Kaya common ito sa heel or even sa toes. Diba napansin niyo din sample kanina sa toes? Baka natamaan ito, nag-history of trauma sa while walking, and eventually wala na alagaan. So kaya, yan. Okay? So, venous as on the leg part, ito sa feet part siya. So, pwede din actually sa anterior shin. So, ito din, magandang summary of all the like venous, arterial, and the ulcer types. Hindi na lang mabasa. Sige, send ko na lang to sa inyo para makita niyo as a summary. Sige, supposedly, na po may quiz. Pero since wala, nag-perform naman mo, mana tatong quiz. Okay, so any question? Mag-perform pa? Pahabol pa? Sige. Thank you.